And it's also one of the things that it does is modernizes some of the things like mileage constraints. Now it used to be that when say well, they want you to be within a certain number of miles with the nurse practitioner, so that if necessary you could rush over there as the doctor and be there within a certain number of minutes. Okay, but now with the way we have telemedicine being done, and with the cell phones, and they just can Skype me and they can say, look, does this look like a seizure to you? And they can just hold their phone up and I can look at it, or we can do telemedicine, or they can pick a picture of a rash, or they can say, does this arm look dislocated to you? And I mean, the mileage constraint just doesn't make sense anymore. I'm not with telemedicine and the new way things are happening. So, and also...
So the 45 miles essentially assumes that if there's a problem, the physician's going to get in a car and drive out to wherever the nurse practitioner is.
That's the old assumption, which is not correct. And what it does do is things like, for example, we have at Beaufort Memorial Hospital, if we get a discharged patient and we want to prevent a readmission rate, which is something that Beaufort Memorial has been grappling with and trying to reduce hospital readmission rates. If I can send a nurse practitioner to Hampton to see that discharged patient from Beaufort Memorial, then they can make sure that the person has doing good transitions in care, that they've gotten all their medicines that they're supposed to get, that they got the hospital bed delivered to the house, and that they have all the equipment that they need to be successful after discharge. Unfortunately, with the way the laws are now, it's too far. I can't send them. They say, well, you're too far away from me, so I can't send you out there with the way the current laws are written. But so we're getting rid of those mileage constraints would allow us to get further into more rural areas, and it makes more sense nowadays with the way that with new communication techniques and things that we have, and it allows us to really do better transitions in care.